Welcome to another episode of the Caucus Corner. Each week, Caucus members connect with the policy experts and community advocates to discuss budget and policy issues that impact our communities from the perspective of communities of color. I am your host, Assemblywoman Michaelle, Solages, chair of the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus. This year, our theme for our priorities and for our legislative push is a demand for justice. And it's really a central mission when we're talking about the Black maternal mortality crisis that's impacting our community. From Rochester to Buffalo to Long Island, as a caucus, we've been laser focused on tackling the issue head on, which is why I'm very excited to have the third episode discuss this crisis, this Black maternal mortality crisis we have, and advocating for Black maternal health. And so there's no better time to talk about Black maternal health than Black Maternal Health Week. And so we gather with exceptional women who are leaders in this space to have a dialogue on how we can safeguard Black mothers. And so I have just these amazing women. I'm gonna let them introduce themselves because they're so dynamic. So Senator Brouk, if you wanna go up first, and then we'll head over to the Assemblywoman.
Thank you so much. I'm Senator Samra Brouk. I proudly represent the 55th Senate District, so that's parts of the city of Rochester and the surrounding suburbs. But perhaps the most important title, other than Senator of the 55th, is also a first-time mother a couple years ago. And my own experience as a Black mother in the state of New York has really, I wouldn't say it started my advocacy and championing of this issue, but certainly made it very, very real. And we've been able to do a lot together with the folks on this podcast over the last few years, and obviously very anxious to get more done. And the other thing I really focus on is maternal mental health. I chair the mental health committee in the state Senate because that is actually, maternal mental health conditions are the most common complication that you see with pregnancy and with birthing people in New York. And so we've got a lot more to do, both at the state and with our partners throughout the state as well. So glad to be here. Happy Black Maternal Health Week.
Thank you. And is the Bronx in the house?
The Bronx is always in the house. Thank you, Chair. I am Assemblymember Chantel Jackson, representing the 79th Assembly District in the South Bronx. Proud to represent this area, not so proud about the amount of mothers we have lost to childbirth. But I spend most of my days thinking about maternal health, not just for myself, because I have 2 children, but also for the Black moms that are around me. And every single year we do a walk in one of my parks to bring awareness to the infant mortality rates that we have here, and also to Black maternal health. So I hold the resolution for Black Maternal Health Week. Very excited to have this conversation with you all.
And I know that Brooklyn is also in the house. Chanel?
Greetings. Commissioner Chantel Porchia-Albert. I am the founder of Ancient Song. We are a full spectrum reproductive justice, birth justice organization located in Brooklyn. And I'm excited to be on this call with such amazing women and champions for Black maternal health and reproductive health and justice in general. It is the inception of Black Maternal Health Week, which is a busy time of the year for many of us who are advocates in this space, who are uplifting maternal health on a daily basis. I am a mother of 6 children, and my experiences with my own childbirth and having an amazing experience with a midwife and a doula was a catalyst for me getting into this work. And so I'm excited to be here and to be in conversation with you all and to see how we can continue to uplift Black women and birthing people in New York.
And so I appreciate y'all. And this is a free-flowing conversation because, you know, there are so many different aspects of this conversation, but I do want to level set, because at the end of the day, we need to talk about the statistics and why this is a public health emergency. So Chanel, could you just level set us and prepare us for this conversation?
Of course. So if we look at Black maternal health throughout the state, we will see some stark differences based on where you may be located. And so if you're in downstate in New York City, although it's a highly dense and populated area, we would think that folks would have easy access to reproductive health care. We find that many individuals do not have access to be able to make an informed decision about their care. We have a infrastructure that is oftentimes broken, being held together by, again, champions in this work. But we find that Black women and birthing people are, dying or suffering a near miss when they are going to seek out care through the delayed onset of care, either due to insurance or even when walking into a space and facing because of budget cuts or midwives not being readily available in the birth room, individuals not being able to make an informed decision about their care, find themselves in a space where they are having to advocate for themselves and not being able to just center their birthing experience. And so through, my work as a doula, we have really championed Medicaid doula reimbursement to try to shift some of those narratives in some places, but there's so much more work that needs to be done. And really, again, building up an infrastructure. If we start to look throughout the state, upstate and more of the rural areas, people are still find themselves not being able to access equitable healthcare services. We have birthing centers that are either closing or on the verge of closing. We have midwives who are losing hospital-based privileges and not being able to provide services within their community. We have hospitals that are closing. And so as a whole, we need to really focus on what does it mean to really center Black women and birthing people and their experiences. And if we say that we love Black women, then we should be supporting and uplifting us at one of the most sacred times of our lives, which is during childbirth.
And it's something that we need to move forward to. This medical model that entraps us Black women takes away from our traditions that we've had for generations, which makes us, ensure that we're surrounded by doulas and midwives and having a joyous birth experience. And so I know Samra and I were working on legislation about making sure that we expand community doulas, right, Samra?
Yeah, exactly. And I love that you, and thank you, Chanel. I have to say, she's been such an incredible partner to help shape some of the legislation that we have done in Albany. But, what you just said was that we come from this ancient idea of having supports, right? You have all of your family, your girlfriends in the room with you. And we have moved to this Western model that is, in a hospital in this, cold, sterile place, far away from any support that would actually be helpful. And so certainly one of the things that we've been really focused on is focusing on the fact that a lot of the statistics that Chanel just went through, these are preventable. These are in some ways man-made problems that a woman can fix in this case and help address, right? So, and that's why when we talk about the community doulas, I'm very purposeful, and we've been very purposeful when we've done this legislation around focusing on community doulas, because we want individuals who are, and in case not everyone knows what doulas are, I always just like to remind people, these are non-medical professionals. So they are not your OBGYN, they are not your licensed midwife, they're non-medical professionals that get informational, emotional, physical support for the birthing person and their partner. And so what our bill did, which we got to get signed by the governor last year, was create this community doula directory to be part of the rollout for the Medicaid benefit for doula care. And part of the reason why I think doulas are such a huge piece of this is they, like we said, they touch on the physical components when it comes to maternal mortality. They touch on the emotional and psychological and mental components, the mental health side. They're a huge, huge piece of combating the maternal mortality crisis. And I wanted to share a couple things just so that people understand. New York is a very forward-moving state, right? We all consider ourselves like a progressive blue state, but our statistics are worse than many other states. And for Black women, Latino women, they are worse off in New York than the US average. So, and in New York City, it's even worse. And Chanel talked about that. And so in the United States, Black women are 3 to 4 times more likely to die in childbirth, right? But in New York State, it's 5 times. And in New York City, and I'm sure y'all will talk about this more for the New York City reps, but it's 9 times, up to 9 times more likely to die. And where I represent in upstate New York in Monroe County, our maternal mortality rate is more than 40% higher than the entire statewide average. So we're not doing well, but we also know that 78% of 78% of pregnancy-related deaths in New York were considered preventable. And so things like the bill that we had together, the community doula directory, the point is to make sure more people on Medicaid know where doulas can be found, which doulas are accepting Medicaid, and giving them more access to what could be life-saving care.
And what I just want to lift up, Senator Brouk, too, is that, you know, community-based doulas are acting as this catalyst. These are individuals who live, they work in the community, they're extensions of their community. And so, you know, where we are experiencing these near misses, you know, community-based doulas are taught to center a framework of human rights and birth justice in the birth realm, right? What does it mean for someone to center their bodily autonomy? They're trained to be able to work with individuals who may have experienced substance usage, or, you know, maybe have a child protective services case, or, you know, looking at ways in which we can move away from the criminalization and the disenfranchisement of Black and brown birthing people, and really, you know, again, uplift their humanity as we're giving birth. And these statistics are not just for individuals who are low income, who are may only have a high school diploma. These are individuals who are highly educated. Maybe you're at a higher socioeconomic standing, and you still are having the same outcomes as a white woman who only has a high school degree. And so we really need to look at the ways in which, you know, Black women are being treated within these spaces. We need to uplift, yes, community-based doulas, and look at the ways in which we are really centering a framework of hope for individuals who are going into these spaces, because not everybody has a choice to have a home birth. Not everyone has the choice to be able to go to a birthing center, right? And so when someone walks through that hospital door, they should feel safe and centered, and not feel like they have to put up their guard and be looking for additional things that could possibly happen when they're just trying to give birth.
And, you know, it's so important that we emphasize community, because at the end of the day, you know, we know our community. And I know, Assemblymember Jackson, you have this proposed legislation about just making sure that we center communities.
Yes, well said. We have the Chisholm Chance Act, and you know, thank you, Samra, for bringing up the fact that in New York City of all places, women are 9 times more likely to die of childbirth. And the counties that are affected the most is Kings County, which is Brooklyn, and the Bronx. And so that's why myself and Senator Myrie have the bill, the Chisholm Chance Act, to create centers for maternal and child care services in those 2 locations. And we're going to focus on things like prenatal care, prenatal and childbirth classes, labor and delivery, risk pregnancy, inpatient and outpatient lactation consulting and support. Like we're here to do the work. We have to stop talking about the statistics and start doing the work to create the solutions. And that's what we're hoping all of these bills, like having doulas present, having birthing centers specifically surrounded, specifically for Black women, knowing that they are most at risk. And so I'm grateful to work with my colleagues on this, and all of the Mom Squad and the legislature.
Yeah, and it's so important, like that mental health piece. Like, people are always focused on like the physical body, but it's like that mental piece that's also important. Like, so many women are postnatally are dying, you know, committing suicide, going through severe depression. You know, why are we not focusing on the mental health of these Black women?
I think it's also the ways in which, you know, the topic around having a baby even is talked about, right? We spend, you know, the communities oftentimes we spend our whole lives, you know, telling folks, don't get pregnant, don't get pregnant, don't get pregnant, to the point where when they do want to have a child and they are pregnant, they have no idea what to do, right? And so, I work with individuals who are a range of ages, from teenagers to adults, who come in and who have the same understanding around their reproductive health options, especially when we're talking about maternal health. And so it ends up becoming like this, when you're trying to figure out what college you want to go to and you're getting all of this, unsolicited materials in your home, you're trying to cipher, how do I find information? Where does it come from? How do I know who to trust? And there's so much information that goes and talks about how to prepare, when to get ready. Okay, you have the baby, but nothing about postpartum support, right? How are we really supporting the parents so that they can support the child? And if we're not supporting mothers, if we're not supporting Black women in being able to parent in affirming ways, then we're doing a disservice to the child. And a mother can't, we can't point the finger and say, well, it's her fault because she didn't do this. We have to look at the ways in which conversations around postpartum mental health have not been centered, or how when Black women have gone to seek out care have been criminalized or either not listened to. And so to your point around, people committing suicide, that is not new. We've seen recently in the news where, a mother sought out care multiple times and was turned away until, and then you find that she ends up committing suicide and also, taking the lives of her 2 children. And those were preventable, right? So those are maternal deaths that are preventable. And we really need to start to look at how are we connecting the dots and also lifting up, these standards. So, Assemblymember Jackson and Myrie's bill, the Chisholm Chance Act, is an opportunity to center, maternal mental health framework, to have a postpartum center where people can go. There's a one-stop shop. I don't have to go all over the place to find something. I can go to this one place and I know I can get comprehensive care. I can go to this one place and I know that I'm not going to be judged. I can go to this one place and I can get the services that I need, not just for myself, but also for my child, and do that in an affirming way. And through, maternal depression screenings that are done from a trauma-informed perspective, we have an opportunity to really, uplift what it means to parent. You know what I mean? Like when you have a baby, there's no, download that you get from the cloud that automatically.
I wish. No, I wish. I wish it was
right,
a
that
manual
tells you,
We all
something.
do.
okay, what to do,
Amen. Especially when I was
and so,
18, that would have been helpful.
Child. So how are we being able to, uplift one another as mothers, as Black women? And that happens through passing good legislation, by really censoring the ways in which people are able to access healthcare services in diverse ways, in ways that speak to them too.
And it's important that we use oh, go ahead.
No, I was saying I wish that cloud existed when I was 18 and pregnant. Like you mentioned, Chanel, there was no conversation around how to keep myself safe, how to have a happy pregnancy and healthy pregnancy, because everyone was so stuck on the fact that I was 18, Black, and pregnant. And so, yes, legislation like this and support groups and support centers are absolutely necessary for women of color to survive during this process.
We got to use every tool in the toolkit, and especially as us as women representatives, Black women representatives, we need to just make sure that we're pushing this legislation. I'm just grateful for our leadership in both the Assembly and Senate that allows us to pass these bills. And I know the senator, being chair, I mean, what more can we do in New York State, and how can people on the ground advocate for the bills that you're pushing?
Yeah, I'm so glad you asked that. I want to put the finest of points on everything that was just said around the maternal mental health, so people understand how serious this is, right? I feel like we understand the gravity of the situation when there's a really awful tragedy like the one Chanel just described, and it hits a headline, and then people just kind of forget. And that happens with a lot of things, right? But the truth is, we're not going to change this by reacting to headlines. We're going to change it by continuing to talk about it, continuing to legislate, continuing to find new ways to address this. Because right now, these maternal mental health conditions that you just heard in this tragic story, they are the 3rd leading cause of pregnancy-related death in New York. So our own Department of Health already reports on these things, and this is what their reports are finding. And so when you think about that, and again, we see it as completely treatable and completely preventable, and the fact that Black women are twice as likely to have these conditions and half as likely to get the help for all the reasons that that we just heard. Obviously, there's a lot of work ahead of us. So, you know, the first thing I would say, if folks want to help tackle this issue, I literally almost changed my middle name to doula, because I believe so much in the work that our community doulas are doing. But for real, like the first person who asked me how I was doing after having my daughter and feeling like I was 36 and had my kid, and I still didn't know. I was twice the age of Assemblymember Jackson, and I still needed that cloud. I still needed someone to download what to do. How do I keep this little baby alive? But the first person to ask me how I was doing and check in on my mental health was my doula. She came to my house 2 days after, as part of the doula service. She came to my home. She made sure I was okay. She looked at me and said, "How are you? How are you feeling?" And that was one of the first people that ever checked in. And that gave me the space to better understand what I needed. So we still need help advocating for doula supports. In this year's budget, we're trying to get 2 pieces of legislation out to help build up the doula infrastructure. So we got a few more days, maybe a week, I don't know, till this budget is over. So let's make sure that, you know, everyone's being loud and making sure that legislators and the governor, that really everyone understands the importance of this. And I think honestly that right now is one of the strongest tools in our toolkit for how we can help address some of the maternal mental health tragedies that we see. And just know that, you know, we have carried legislation and we're hoping to get it passed and signed this year as well, about making changes to these depression screenings, making them easier to be administered, and to do what Chanel talked about, of having more cultural competence on these questionnaires and making sure that we're really tapping into the full experience of being a mother, culturally, linguistically, and making sure that we can capture when someone's really struggling. Because right now, a lot of these screenings don't do that.
And I want to just hone in on that cultural sensitive piece, because I know, you know, we all come from different backgrounds. You know, I'm Caribbean, you know, and I know that there are like sensitive cultural things that certain people do. So like for me, when I was pregnant, my mom, I couldn't take the baby outside for like the first 3 weeks, even like just to the doctor appointment and back. I know that like there's other cultural things in other places.
Yep.
Yeah, and
I think that was me too. Go ahead.
Yeah.
Yes, no going out. And one of my Asian friends shared that their family stay with them for a month after the baby is taken care of, and the mother is not allowed to lift anything. They cook every meal, they take care of everything. So
Ooh, I like
your doula, exactly, and like and doulas are supportive in that way too. Not that they're gonna come and cook and clean for you, but they're gonna come and support you.
We'll do some of that. We will do some of
Right,
that.
right. You know.
But also, like, you know, it's a, you know, and in some cultures, you know, even in our own city, New York City, you know, there's a postpartum home where individuals can go. But what if it was like financially accessible to everyone, right? To be able to have that time where you can sit, you can bond, you can center yourself as a mother, you can heal properly, especially if you've had major abdominal surgery and, you know, you're being taken care of. And that's how it's supposed to be. Like, we were supposed to have these connections in our communities. And so doulas are like providing this lifeline to individuals, whether, you know, your family is here or is not, offering culturally humble care, right? Meeting people where they are, not where we expect them to be. And checking in, like doing really like stuff that should be common. You know what I mean? Like, how are you feeling? Like, what do you need? You know? And those are things that, you know, as a new mom, second time mom, if you got 6 children like myself, like you need to know that someone is checking in on your well-being and you know, and centering you. And it's just the simple things, you know what I mean? Like, I think sometimes people think that, you know, it has to be this long drawn out process, but no. And that's why, you know, I give thanks for these bills, because it creates an opportunity again to create a framework, to continue to lift up the profession of doula work, to center, you know, community-based doulas and the expansion of their work and organizations, and really removing the limitations of us being able to practice, you know, within hospital-based institutions, moving to a trauma-informed space where we are looking at the ways in which we are centering maternal and mental health. And then, you know, again, creating centers, right? Especially for the community-based organizations that's going hard, especially like in the Bronx. We got BX Rebirth, who is doing an amazing job to be
Love
able,
them.
yes, to be able to center their community, and, you know, in Ancient Song and Brooklyn and so many other countless organizations that have been on the front lines to really center and uplift community members in amazing ways. And, you know, it all starts with, you know, I think just a conversation. And so I give thanks for you all being able to center that conversation. And yeah, let's pass it in the budget. Let's make it happen.
Yeah. And we also need on a federal level to change a lot of these laws, because like for New York, we have the strongest paid family leave law in the country. But, you know, we need to make sure that's across this nation and change that culture that women should just immediately go back to work after having birth. And also expanding childcare so that, you know, we have proper, accessible, quality care for our kids.
That's affordable.
Yes,
exactly.
Affordable.
Yeah. So, you know,
and also changing culture, right? Michaelle, like we bring our children to work, and changing the culture where moms are, if you expected a mom to succeed at the workplace, then you have to make sure our children are safe and okay.
Exactly. Yeah. It's all about making sure that we center the families and center moms in our country. You know, you go to other places, right? You go to places and they have like these beautiful birthing centers for mothers. They provide, you know, 6 to 12 months of paid family leave. And in America, we're kind of like behind on that, which is ridiculous. But I digress, right?
Yeah.
You know,
we support it. We support.
Yeah, no,
for it,
100%. And I would say, even honestly, if you really want to talk about supporting moms and Black mothers, also giving all that time to the fathers. My husband had 4 months off when we had our baby, and I had none. And so, you know, he held it down. And you know, when we say family leave, we mean the entire family unit, whatever that looks like. But we are so far behind. It's honestly, it's irresponsible. It is unacceptable how far behind this country is when it comes to actually supporting families. But luckily for us, we have more women, more mothers, more women of color in the legislature in New York than ever before. So if anyone's going to help get it done, it's going to be us.
We have 66 women to be exact in the Legislative Women Caucus that makes up the Senate and the Assembly bipartisan.
Yeah, and when we understand too, to, you know, Senator Solange, your point about fathers and paid family leave, just thinking about the fact that maternal mortality affects them too, right? And so we have numerous brothers who have lost their wives and their partners in childbirth, right? And who are now, you know, having to raise children as a single father, right? So when we're talking about uplifting maternal health bills, we're also talking about the ways in which they affect entire households. We're talking about the ways in which they're affecting, you know, a father's ability to be able to parent if they happen to lose their partner, right, during childbirth or from, you know, childbirth related complications. And so we want to continue to lift up fathers, continue to lift up these bills, and know that, you know, when you're lifting up Black women, you're lifting up all women, and you're lifting up an entire community. You're not just lifting up individuals.
Yeah, and I just want to throw Shaija Simple's name in the mix, because we lost her in 2020. She was 26 years old in Brooklyn. We lost her during her time giving birth to her child that now her partner has to raise. So I just want to leave her name in this space.
Yeah, blessings and prayers to all the women that we've lost. That, you know, even the New York State Maternal Mortality Review Board said that 76% of these deaths are preventable. So what can the average New Yorker do to help uplift these bills and also help tackle the maternal mortality crisis?
I think it's important for us to, one, continue to have these exposing conversations like this one. Also, the resolutions that we have to continue just talking about it and making people aware of it. And implicit bias is a real thing. Systemic racism is a real thing, and it's happening within our medical system. And so we have to acknowledge that exists and start combating those things. So the average New Yorker should be listening to conversations like this, letting Black women speak and lead in conversations like this, and also being part of the solution, figuring out where your implicit biases exist and what role do you play in systemic racism.
And we also need to encourage women and all New Yorkers, if they are interested in becoming a doula or a midwife, or even becoming a healthcare professional, especially like a doctor, we need more people of color in the pipeline for all these professions. So if you are interested, please get into those careers, because we need as many, of us in these professions to be culturally competent and provide healthcare that's accessible and appropriate.
Yes. And while we're doing that, also creating equitable pathways for people to be able to do that, right? Because we also know that there's sometimes a high expense burden in people trying to become midwives. And that's why we find that there is, if we look at Black midwives as a whole nationally, they only make up about 2% of the midwifery population. And so, when we really want to create equitable pathways to build up the perinatal workforce, providing funding so that, individuals can become OBGYNs, they can become, maternal mental health specialists. We don't have enough, individuals who are focused on, in particular, the discipline of maternal mental health. Looking at, the expansion of how people are able to access that education and that information so that they can work in the communities that they want to work in, and do that in meaningful ways.
Can I make a plug too, as more people are getting into this profession? We need them upstate. When I was looking for a Black female provider, when I was going through my process having my child, my husband and I literally had an entire spreadsheet, and I told him he had to go out and find all the Black providers so that I could find someone I trusted. And it was difficult. That was not a very long spreadsheet. They are few and far between. So also having, there's Black people up here in upstate New York, and we're also looking sometimes for providers who look like us, who have that cultural competency, as our preference. And it's very, very difficult, whether you live in a rural area, whether you live, outside of a major city. And so, legislatively, I know we're working on things as well to help incentivize folks to come throughout the state, because statistics are bad up here, and we deserve choice. Just like any other birthing person, we deserve choice, and we deserve, if we so choose, to have support that looks like us, that has similar experience, and that we're at the end of the day more comfortable with.
Indeed. 2 snaps for that. I definitely looked for a Black OBGYN when I had my second child. Having a little more information on mothers who were dying through this process, I wanted to make sure that my chances were much higher. And the reason why we need more than just the few that we have is because they're Black. They were still taught in white institutions, and not saying, just acknowledging that culturally we are different. Our bodies may be different, our upbringing may be different. And so we can't just have 1 and 2 Black women and men in this space. We need multitude, because everyone is going to have a different experience.
Well said. So we reached the end. I know this was fun. I always love, hanging out with such powerful Black women. But is there any last words, anything that you want to leave our great listeners with?
Thank you, Chair. Oh, no, please go ahead.
No, I was going to say, yeah, thank you for hosting this conversation and for allowing us, to be able to come together. And thank you, Assemblymember Jackson and Senator Solange, Senator Brouk and Assemblymember Solages, for creating space, for being champions, for being mothers who not just seeing the need, but are acting on that need, because we oftentimes, people will, talk a good game, but you're actually moving the needle in the work that needs to be done. And for folks who are interested in, in uplifting this work, it's real simple. Have a conversation, share this information that you just may have learned during this conversation, connect with a community-based organization, volunteer, gather information, pass it on, you know what I mean? So if even if you're not, pregnant or don't plan to be pregnant, at least you have that information, you can pass it on to someone else, and continue to, uplift Black women and families and birthing people, as because we're all part of a community, and what happens to one person affects us all.
Ashe. And I'll say thank you again, Chair, for just having this conversation, being a dynamic woman and mother. Also to Senator Brouk. I create space in my office for CSE Birthing Freedom, which is a community-based group, and we are here. They're in my office doing pregnant yoga, a multitude of things, hosting classes, and creating just space for women to exist and talk through what it's like to be pregnant and to deliver a baby and to be postpartum. And so let's continue to support our community groups. Let's continue to support mothers and their entire families because fathers are just as important. And I want to say thank you again for this space.
Yeah, I'm going to shout out all the beautiful, brilliant Black women, Black mothers on this podcast. And it's just such a privilege to be able to do this work. And as Chanel said, you know, we don't just talk about it, we are about it. And this is something that we obviously think about every single day. And I don't think any of us has any intention on resting until we start seeing the results that we know our families deserve. And I'm just really, really proud to be in this space with you all. So thank you.
And thank you to all. And I want to make sure that all of the mothers out there know, and all the birthing people know, that we are listening to them. We're here for them. You are not alone, and we are fighting for you. And so thank you again to all our guests on this podcast. And we encourage you to follow us on social media, BPHA Caucus on Instagram, Twitter, Facebook, YouTube, all those platforms. Follow us, subscribe, and I look forward to seeing you at the next Caucus Corner. Thank you.